Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. And we have another guest today. Her name is Dr. Nicole Fleischmann. She is a urogynecologist, and I will let her explain to you what that is. But we're going to have an in-depth discussion on the pelvic floor, what that is, what what it really means if you have pelvic floor dysfunction, which seems to be one of the hot topics you see being talked about today. So we're going to get her version of what it is, what causes it, and what we need to do about it. So, Dr. Nicole, welcome to the Thyroid Answers podcast. How are you today?
Thank you for having me, Dr. Eric. I'm so happy to be here.
Well, I am glad you came. We talked right before we got online. We had one person on here talking about pelvic floor and the trauma of childbirth and why we need to take it more as an injury and a trauma and almost treat it like a sports injury than a pat on the back and send you home and just rest for a couple of days and you'll be fine. But I think we're going to take a different angle on it today with your discussion. So can you give the listeners first a little bit of your background, how we got to this point where you're now on the Thyroid Answers podcast talking about the pelvic floor?
Right? I was trying to ask myself that same question. Why would a urogynecologist be on a thyroid podcast? And I was trying to make the connection, and I think I'm getting there. So I'm a medical doctor, trained, in New York, and I've done a residency in urology, which is really a men's health field that has also a huge women's health subcategory in it. But nowadays, urology, in order to treat urology for women, we have changed the field to urogynecology. So after urology, you do advanced training in this second field in female pelvic medicine. It's a very surgical field. So I'm primarily a surgeon. I actually started off in general surgery, and I gravitated over to urogynecology after about a year. And in residency, I switched very early on because I saw a huge need in women's health. I just realized that there was a niche there that I was missing because I hadn't really considered urology when I was in medical school. I thought that only men went to urologists. I didn't know that it was a women's health field, and I was always very interested in women's health. So the short story is I did a full 7-year training, and it's very surgical. I do a lot of robotics. I'm lifting bladders. I'm fixing incontinence. Very, very surgical. And and that's who I am. And I'm in clinical practice. I'm not really, I am institutionally affiliated, but I don't consider myself an academic. I left academic medicine very early on, although I'm fellowship trained, because I really like treating women. My passion is just being a doctor, and I appreciate the healing parts of medicine. And I felt like when I was in an academic medicine environment, it just really it wasn't feeding my soul. I like actually making people better and listening to them and, you know, getting to the hearts of their problems. So that's me.
All right, so we're going to talk about pelvic floor. Let's start with the basics. Like, what is the pelvic floor, and then we can get into how do we regulate it.
Okay, so if we understood what the pelvic floor was, we would not be sitting here today having a podcast about the pelvic floor. The pelvic floor is so when I think about the pelvic floor, I think about, like, you ask me, like, what's your hand? What's your
Mm-hmm.
head? Like, why do I have to show you where this thing is? It's a structure in everybody's body. Okay. And it's something you can touch and you can feel and you can move. And the fact is, for most of us, we don't even know where it is. And that's the problem. That's why that is the definition of pelvic floor dysfunction. It's like you have a hand and you don't know you have it. All right. It's like an appendage, and it's like you're numb to it. It's just this thing hanging there, and you're basically hitting it on the wall as you keep moving because you don't know it's there and you're injuring it. So that's what pelvic floor dysfunction is. It's a group of muscles that, if you think about where you would touch them, they're in, you don't have a vagina, but if you put it in your vagina, and men can do this, they could put a finger in their anus and get the same feeling of where the pelvic floor is. You kind of put pressure towards the back side, and though that group of muscles is your pelvic floor. Okay, so I call that pressure towards the backside, and it can really go all the way back to your sacrum and your coccyx. That's the pelvic floor jaw. So when we talk about how the pelvic floor moves, it moves like the jaw of a mouth. You can put your finger in and put pressure, and your sacrum and coccyx will move backwards, and you're opening that jaw to widen the orifices of your anus. That would be in the case of a man, of the vagina, anus in women, and the urethra. So we're widening all the orifices when the pelvic jaw opens, and that's a neurophysiological mechanism that all humans have.
So essentially, there's a group of muscles in there that control a lot of different actions and functions. What are some of those actions and functions? I mean, you kind of hinted to some of them, but what's the primary role of these pelvic function or these pelvic the pelvic musculature?
Now, the pelvic musculature is like a diaphragm. You can think about it like one of your diaphragms, and it has a lot of roles. One of the roles is to support your organs so they don't fall out of you, especially in women, because, men have a slightly different anatomy. Their organs don't fall out, but women's vaginas they're not muscular walls in the sense that they have, striated, strong muscles. So these muscles are a little bit flimsy, and they need support of these other muscles so that the organs don't drop out. And that's the pelvic floor. But the pelvic floor has another function. And I would say this is its most important function, and it's to manage our biological processes. Okay. The bottom ones anyway. Okay. So urinating, defecating, these are managed by the pelvic floor. So is childbirth, delivering a baby, and also just anything you want to enter or exit that area, the pelvic floor is managing. Okay. So in most cases,
Pooping,
it's an exit.
peeing, everything.
Pooping, pee, anything that's going through that area, the pelvic floor is like that doorway that controls it. Okay. And you have the ability to open and close that door, but that requires pelvic floor awareness.
Mm-hmm.
And that is something that most of us do not have.
Yeah. So we want to get into that piece of it, right? And that is, I think, when you talk about the muscles being flimsy, are they truly flimsy by design, or are they flimsy because of our habits, our behaviors, our lack of, I worked out this morning and
I
I
never
do my
said the muscles were
biceps, right?
flimsy.
But you know what I mean?
Yeah, but I never said the muscles were flimsy. The muscles are not flimsy.
Oh, I thought you said that in the beginning.
It's the vaginal wall that's flimsy, because the vaginal wall is not made of skeletal muscle.
Okay.
Okay, I'm talking about the vagina. The vagina is the support structure of our organs. It's hard to explain this, not the pelvic floor, but the pelvic floor is the door. So you can have a loose vagina. That's like what a hernia is, where the organs are just not being supported, but your pelvic floor can be too tight.
Okay.
That's actually how it is mostly. And we can go into these dynamics. They're complicated, but they're very important for people to understand so that they can understand what they're supposed to be doing.
Yeah. A muscle can be tight because it's contracted and has a level of strength for a short period of time. But the longer it's tight and contracted, the weaker it gets.
Exactly.
So everybody knows if they have a muscle spasm, that muscle is contracted and it's tight. But if you leave it like that, it's over time, it's going to get weaker and atrophy. It's a pretty easy experiment you can do to show somebody how quickly a muscle can fatigue. And I agree. That's probably a huge issue with what's going on in the pelvic floor and everything around a lot of that core musculature. So let's talk about control of the muscles. What's really leading to control of the muscle? Is it primarily, I know probably have a pretty good feeling for what you're going to say, but we talk about it's used to kind of control a lot of these ins and out actions of the urinary tract and the GI tract. And a lot of that's likely under involuntary control, because we're not sitting there thinking about, hey, I need to do this or I need to do that. So there's probably a level of voluntary control, but also a level of involuntary control to this musculature. So can you explain that?
Right. So actually, most of us are working with involuntary control of this musculature. I think about the pelvic floor in terms of child development. You have to understand, you have to go way back here, because what we're really dealing with is bad toilet training. And that's what I have a book out about this that I wrote. It's called The Second Mouth. And the basic premise of the book is that none of us have been toilet trained correctly. That we've missed the second stage of toilet training, where we learn how to release the muscles of the pelvic floor. But none of us have learned that release. So we're just not doing it. None of us know how to release our bottoms. It's something that has to be taught. And the body is very resilient. It allows us to function without knowing this release mechanism. But we only get a certain amount of time on this planet to learn that. And then things start to break down.
So why would we not learn it? Is it because we've modernized how we go to the bathroom? Early day, we squatted and dropped a dookie and got on with our day. And nowadays, everybody wants to sit on a comfortable throne. And one of the challenges is we don't even want to bend down sometimes, squat down to get on the toilet that was actually lower, that had our knees probably above our pelvis. And today, everybody wants to sit on a comfort height toilet, which then probably changes the dynamics of that musculature. Is that close?
It's part of it. It's part of it. It's in there. But the thing about it is that pelvic floor control. See, as human beings, we're allowed to sit in different ways, but we have to understand how our bottoms open and close. And when you're in a squatting position, you kind of don't even need to know, because your body is in such a toilet posture that your body will just release. If you're not in a true toilet posture, your body is not going to release easily, okay? Because you have to release your pelvic floor. And on the modern toilet, if you're 90 degrees up and down, yes, you're not in release position, but you can easily achieve that release position just by leaning forward. So I teach toilet posture, and this is what we do with kids who are dysfunctional voiders. We do something called urotherapy, which is where we teach them toilet postures. The problem is that most people never get this information ever, and they do whatever the hell they want, and they don't understand that these behaviors matter. What you do on the toilet determines how your nervous system functions. It is that deep.
So let's dig into that. I want to circle back to this later when we talk about how the nervous system may impact the pelvic floor and the pelvic function, the ability to have a bowel movement. But how does having the appropriate squatting position have the impact on the nervous system itself?
Let me go back a little bit. We're going back to toilet training here, okay? When you are 3 years old or 2 years old and you're trying to get out of diapers, which is exactly what we ask our 2 and 3-year-olds to do, you have to learn to hold. Holding is the first cognitive skill for a child, and we do a pretty good job of that. Holding is kind of intuitive to a child. We discover our guarding reflex, which is what we're talking about, and we use it violently to suppress our bladder. Okay, because when you guard, that's bladder suppression. Okay, and when you suppress the bladder, the capacity of the bladder expands about two to three times its size in the first 2 years of life, which is how we are able to hold urine. Okay, but that guarding reflex is really easy for a child of 3, but we are not cognitively developed enough to understand release. Release is a much more complicated mechanism. A 3-year-old does not have the executive functioning to understand it. So what the 3-year-old knows is pushing. A 3-year-old, it's very normal for children to push to pee, and you're using your peripheral nervous system to do it. Basically, it's a little push and it starts the stream and it works, because our bodies are resilient at that age and they allow the pushing behaviors. And I'll tell you something, most of us do not even know we're doing it. It's so natural. It's just the bearing down to start the stream. The problem is it's a developmental stage. It was not supposed to stay. And the second stage of toilet training is the one where we learn that we are not supposed to push out our pee. We're not supposed to push, because pushing is a way to release urine without releasing your guarding reflex. Okay? So that guarding reflex is a sympathetic state. Voiding is a parasympathetic function. If you keep your guarding reflex on the toilet with you while you pee, which is what children do, you're creating an autonomic dysregulation in your system. You cannot pee in a sympathetic state. So when you're in that deep squat, that is automatically putting your body into a parasympathetic state. automatically. It's the posture alone is what's doing that. And that posture of squatting, we use it in all areas of medicine. That we just know that posture just that takes you automatically into your parasympathetic state so you can release. The body will only release in parasympathetic. Now, if you are not in a parasympathetic state, or at least if you don't create that, you can push, you can posture, and things will leave, but it will not be coordinated. There will be no flow. You will not empty. And as you get older, this is going to start to break down your system. And that is why pelvic floor function is the seat of health.
Okay. So let me touch base on a couple of those points. So early on in functional neurology training, and we learn about the primitive reflexes, right? So, and when back in the day when I did a lot of functional neurology, we'd have somebody who had neurologic issues, and we would still, even in adults, we'd check it in kids, but even adults, we'd go back and check for persistent primitive reflexes and see in some of these adults, especially those who had injuries or traumas, we'd see, hey, these are primitive reflexes. These things should be gone, but that give us a big idea of what's happened to their physiology, that their body is diverted back to primitive reflexes being a dominant factor. Are you saying that this urge to push is one of those primitive reflexes, and because of poor training and development, as we mature, we're not overriding that, and we're holding that back in? Is that accurate?
So we are not learning how to release our guarding reflex. We're just living with it, and it's there all the time. And for most women, especially after childbirth, they're guarding harder. So maybe your C-section person was talking about the trauma. The second trauma is the guard. Okay. So the first trauma is the actual injury. The second trauma is the guard. It's your body's guarding around the injury. If you do not know that you are guarding, if you are not aware that you are doing it, which most of the time you're not, the body doesn't heal. It scars, it fibroses. So this is how trauma creates problems. You can heal from the trauma easily, but if you're holding the trauma by guarding around it, your body is never healing. And this is what we see. The guarding reflex gets really strong. We are not taking it down. That is something we have to learn how to do. And there's only one way to do it, with our breath. And this is the problem. Breathing, proper breathing, should be coordinated with your flow. And that's the second stage of toilet training. You are not supposed to push out your pee or your stool, by the way. This is both. You're only supposed to breathe them out.
All right. Well, we're going to come back to that in a bit. Okay. The other thing I want to talk about, because you're talking about from a stress perspective, somebody might think about this. Well, when people are stressed, they release their bowels or they release their bladder. How does that different from what we're talking about?
I love that you asked these questions, and because I love getting into this stuff. So now you're talking about overactivity. So now we're talking about overactive bladder, overactive bowel. So I think we could almost talk the language, and you could replace thyroid and bladder, because I think they operate similarly in the body. Okay. And I think that is one of those connections, the mirrors that we make. I think the body is a mirror image, top and bottom. Okay. So when you're in a overactive bladder state, that is an inability to suppress, your bladder's just getting stronger. It's trying to overcome your clench. So it's working really hard. And we see this a lot in women who have this like inability to take down their guarding reflex. They're pushing their pee. Their bladders start to get fibrotic. They get all these trabeculations, we call them. You can actually see them on a cystoscope. That's bladder dysregulation. So the bladder just starts contracting all the time. You have to constantly suppress it. It has no control. It's out of control. Okay. And that's what overactive bladder. And it's the same thing in the bowels. This is your inability to take down your guarding reflex on the toilet. It's irritating and dysregulating your bladder and your colon. So basically, the same mechanical thing can cause one of two things. So compression of the guard can either cause an underactivity of the bladder or an overactivity of the bladder. Same thing, different in different patients. It doesn't mean that they're doing something differently. It's just their body is responding differently to that same internal action. And a lot of that just has to do with their makeup, how they respond, how their body responds to stress.
Okay. So before we get too deep into some of the mechanisms here, I guess some people are probably sitting here going, well, how would I know if this is a concern for me? So what are how would somebody know if they had some pelvic floor dysfunction? Are there obvious and less obvious signs and symptoms that this may be a current problem or a developing problem?
I want you to know, if you're listening, you have pelvic floor dysfunction. I want you to just understand that basic principle. Now, because it's a developmental problem. And if you haven't been toilet trained properly, you have it. Now, whether it becomes symptomatic in your life or not has to do with your nervous system, how stressed you are, your makeup, how much trauma you have, how you handle things. This is, and I'm going to tell you, it gets everybody when you're old. So, old age is where I get to see all of these things start to just blossom in everybody. Nobody escapes this in age. And the earlier you turn this around in your life, the less likely you will suffer in age with all the things I see, the recurrent urinary tract infections, women are in diapers. Everybody's in diapers. That is not supposed to be what happens to us. It's happening to us because we have never learned to take down our guarding reflex. And as we get older, it just gets worse. And then you can't turn it around. So you have to learn this. Everybody does. Because if you think you don't have a problem now, you probably don't. It's just festering in you. Just wait till you're 80 and you'll understand what I'm saying. And then I'm going to say, I'm sorry. I wish you learned this when you were younger. Too late now.
Well, it's probably been an issue, but I think it's more people are aware today, but I think we're doing probably the wrong strategy. We can get into that more later, because all we've done is say, hey, everybody has this. This is a normal condition. You should just wear adult diapers and life is great. And look how happy these people are in their adult diapers as they're dancing in their living room in adult diapers and
makes
going
me
out
sick.
things.
Makes me sick.
So we see a problem. We create a something that'll manage the condition versus say, okay, let's actually address the root cause of the issue, because it's probably not as profitable if I'm thinking about the way industry typically works.
Yes.
So I guess we should just ask that question then. I guess it's like, how big? You're saying everybody's probably has some level of pelvic dysfunction and it's going to show up at some point, but how big of an issue is it? Are we just, as we like to say, we're doing a better job detecting it now than we ever were? Or is the problem actually getting worse because we're a more sedentary, obese, inflamed society? Like, is it getting worse, or has it always been a really bad problem and we're just better at detecting it, is what we often hear about all conditions?
I think it's a combination of both.
Mm-hmm.
And I think it's also the ability to talk about it. I think women are angry about this stuff. And by the way, it affects men too. But women are more symptomatic from pelvic floor dysfunction in general, just because of all the childbirth stuff.
Mm-hmm.
But I think women are tired of just not getting any answers to their problems. And so we're talking about it more and we're naming it and we're saying what it is, but we're still not getting help. Because everybody's just telling us to do Kegel exercises and squeeze and tighten and control, and they don't understand how harmful that is. And I'm out there saying, stop squeezing your bottom. Stop. That's what got you here to begin with. You have to learn to open. You don't even understand that you have an opening mechanism on the other side of your body, and you just have to learn you got one, and you have to learn what that means. And anybody can if you go through toilet training, but we're not toilet trained.
Yeah. So I guess that's got to be a mission, right? Is to how do we go about retraining people at an early age? I haven't seen too much discussion on that. Maybe you're trying to push that forward, and that's maybe one of the big reasons to be on the podcast.
Yes.
But let's talk about dysfunction. Like we say, okay, we didn't learn well. We still have a primitive reflex that may be persistent. Injury for women, definitely trauma. Childbirth definitely is going to be a trauma to that area. But I think you already alluded to it, but real or perceived stress, in my opinion, is probably one of the biggest factors that alters our overall physiology, especially when we think about thyroid physiology. I think so many people have been told that your immune system is damaging your gland. It's an autoimmune condition. Your immune system just doesn't identify your gland as self tissue anymore, and that you're screwed. You're going to have hypothyroidism for the rest of your life. And in my world, in functional medicine, people would say, well, not only did your gland forget how to work and your immune system start destroying it, but you forgot how to convert T4 to T3. And so now we have to give you T3 too. And we'll just keep trying to manipulate the blood values. And my thought process the whole time is like, wait, we have an innate intelligence here in the body. And oftentimes the body is trying to not destroy us. Our cells, our tissues, our immune system is trying to protect itself and us in general. And when we see a condition, high blood pressure, hypothyroidism, inflammation, instead of suppress, we should be saying, wait a second, why is the body doing this? And how can I help this process out? So when I talk to clients all the time and they can't find the magic mystical number or dose of thyroid hormone or the combinations of them, I'm like, it's less about your thyroid gland. It's less about the magic dose. It's about your cellular state and what I call either the homeostatic state, where I make enough energy from all the food I eat to run all of the systems of the body properly under whatever load I'm under. Could be a high load of stress, could be a low load of stress, but I can manage and run it all. And the other state is allostasis, which is I don't make enough energy to run all the systems of the body optimally under my given stress load. So something's got to give. I've got to downregulate hormone regulation. I got to downregulate gut function. I got to downregulate detox. I got to upregulate immune inflammatory mechanisms to find this thing that's stressing me and creating a problem, which is great if it's an organism. But what if it's our mind? What if it's our real or perceived stressors from our life environment? How much can you go into this for the listeners? How much what we think about life experiences has a potentially really negative impact on our overall physiology, and how it might really have an impact on our pelvic floor and the functions within our pelvics?
Well, you're speaking my language. So when you are in a state of chronic stress, which could be from your thoughts or the things you're thinking. Absolutely. Thoughts are very, very powerful in the body. You're in a guarding state. Okay. And what we're trying to do is understand when our body is in a guarding state, because for most of us, we are walking around in a guarded state. That means we are walking around. Can I be so bold to use these terms? We're walking around butt clenching all day.
Mm-hmm.
Okay. Butt clenching is what we are talking about here. Are you clenching your butt all day long when you walk around? That is your guarding reflex. Okay. And if you are butt clenching all day, you are basically telling your body that you are stressed. Okay. It's a very simple mechanism. And I don't even need to know about T3, T4. I don't even need to get into the metabolics. To me, I don't need to control my thyroid. I don't need to control my liver. There's only one thing that I am supposed to be doing, and that is taking down my guarding reflex, because it is always there. And I need to know it's there, and I need to take it down because I don't need it. It's not there to hold anything or do anything. It's not a supportive muscle. It is just there to be annoying, because it's a primitive reflex and you haven't gotten rid of it. And so if you don't get rid of that primitive guarding reflex at the bottom of your body, which we can call your butt clench, there's only one way to get rid of it. Okay. It's not just about going in and knowing it's there and saying, okay, I'm not going to clench. You have to sniff to it. You have to breathe to it. You cannot take it down without breath. And now we're getting into the heart of what I am talking about. If you do not know how to breathe and you do not do it 10 times a minute, that is your job. You could not regulate your thyroid, your liver. They do great on their own, but they do require something from you, and that is your breath. And if you're apneic or you're an upper chest breather, forget it. Don't expect nervous system regulation. Not going to happen. If you're sucking in your stomach all day and clamping your glutes all day and exercise training that way, don't expect an inner calm. Not going to happen. And that's how the body works. Become aware of your butt clench and take it down with your breath. And it goes like this. Eric, look at me. Take a sniff. Just through your nose. So it's not with your chest. Just sniff like you're sucking in snot.
Yeah.
You'll feel your body get it at the bottom. That's
Mhm.
pelvic floor awareness. When you feel your sniff hit your bottom, that is the definition of pelvic floor awareness. That is the last stage of child development. That is how you pee. That is how you poop. That is how you breathe. If you don't feel your breath hit your pelvic floor, which only happens with a sniff, you are not going to know how to regulate your nervous system.
Yeah. Well, I think appropriate breathing is critical. It's one of what I call my foundational fitness factors. You have to have optimal respiratory fitness. Unfortunately, most of us don't have it.
Right.
And because of that, so many systems are constantly helping activate our sympathetic nervous system and actually
Yes,
making that primitive reflex. Actually, we're making it stronger because we're activating it
exactly.
all the time. So it just gets
All the
stronger and
time.
stronger and stronger. Just like if we're emotionally stressed, we're firing that limbic system up constantly. And now
Yep.
that limbic system, which should have been tamped down, is now hypervigilant. So just like a deer eating in the woods is constantly looking up to see when the next animal is going to come get it, we start to act and behave that way. So we think we're more resilient to stress because I'm under a lot of stress, and you're probably less resilient to stress because you're just hyper vigilant and you're over firing that system up. So I agree. I mean, it is one of the things when I started, when I wrote my book, The Thyroid Debacle, I started with 10 fitness factors, dietary fitness, a whole bunch of different pieces. But mindset, mental fitness, cognitive fitness, respiratory fitness, sleep fitness, they're all in there. And the respiratory fitness is the one that a lot of these things are the low hanging fruit things that people can work on. They don't cost anything, but they're the things we're less likely to work on. But respiration and breathing is critical.
And not only is it critical, it's the hardest one to work on. That's one of the reasons. First of all, I want to tell you that nobody knows how to breathe. And I say this broadly. Nobody has learned how to breathe. Nobody even knows where their diaphragm is, much less how to activate it. We have a world of mouth breathers, and nobody is calling us on how mouth breathing kills us, how mouth breathing does not oxygenate our body. It does not
Mhm.
regulate our nervous system. It does not oxygenate our brains. So if you really want to do something nice for yourself, stop mouth breathing. Start feeling your lips together throughout the day, and take a breath through sniff inhalation. You have to start with the sniff. The sniff is the start of your nervous system respiration. Your nervous system will pee and poop for you, but you have to sniff first. That's how you pull air through. And that is how you oxygenate your body completely. Your bladder, your colon, they all need air. You are not giving air if you are breathing shallowly with your upper half. If your chest is expanding, you are not breathing correctly. And we all think our chests are supposed to expand because that's where our lungs are. See, humans are smart and stupid at the same time. We're like, yo, this is my lungs. I'm going to feel them expand. No, that is not how the body works. And you need an educator who is a little smarter because they've gone through training to say, you know what? I know you would think that your chest should expand when you breathe, but that's actually only when you're in a panic state. And if you want to be in a panic state, keep expanding your chest to breathe. If you want to get out of panic state, find your diaphragm. When you sniff, you can feel it move out. But you have to also have a straight back. You can't be slumping. You can't be walking around with your shoulders forward, and you also can't have a big arch in your spine. And don't tell me, oh, I just have an arch in my spine. No, you're holding yourself that way because you don't have any postural control. You also have to let your belly out. You have to stop sucking in your stomach because when you do that, you are suppressing your diaphragm and you cannot breathe. So we have to get rid of this culture of stomach sucking. We are training ourselves to do it. And that is the heart of what's going on with humans. We don't know how to breathe. We just don't even know what it means. And that's the problem. It's so basic. It's so idiot. It's like idiot stuff. And yet we are all failing at it. And we don't understand. We need to learn, and it's our responsibility.
Yeah. I think we often do this in life is we jump over dollar bills to pick up pennies instead of working on these foundational concepts that are critical to well-being. Because it's like, I don't want to change anything. Just give me a supplement that's going to fix it. It won't. Medications and supplements are really there to manage conditions, not necessarily recover from conditions. So they can be tools, but they're not the tools. I've talked about this on multiple podcasts on why it's so important to breathe appropriately. But I think it's worth having that little bit of the sciencey conversation as to why improper breathing can be problematic. Most people would think if I just it doesn't matter. I'm breathing oxygen in, I'm breathing oxygen out.
I'm alive,
How does that
so I
affect my
must be
brain?
breathing. Right.
Right.
But so breathing is a free for all for most people, and it really shouldn't be. There's only one way to breathe. And unfortunately, it requires you taking down your guarding reflex. See, that's the problem. You have to have the neurological capability to do that. And if nobody shows you how, I guarantee you are not doing it. So the sniff maneuver, where you pull air quickly through your nose, that is immediately going to connect to your guarding reflex at your bottom. And your guarding reflex is going to snap back at it. Okay, that's the primitive reflex. What you need to do is not allow that to happen. So when you push with airflow, which is what you're supposed to do when you pee and poop, that's the second stage of toilet training, you are immediately suppressing your guarding reflex, okay? And that is putting your body into a full parasympathetic state, which is what breath should be. Breath is a way to regulate your nervous system. And it's your job. See, you can't regulate your stomach. You can't regulate your liver, but you can regulate your breath. It's the only thing we actually have control over, and we absolutely do not control it. It's crazy. We want to control everything else, but the one thing we actually could control. But the thing is, you have to put attention on it. It means you have to have attention to your internal body to control your breath. And in this world, and this is where we get into like how the world is busy. We got the social media, we got the this, we got the that. Our attention is always outward. Mm-hmm. And that's what the second stage of toilet training is about. You have to learn to turn your attention into your body to feel it move properly with your breath throughout the day. That's your job. Your job is breathing. It's your only job. Before anything else, before you pay attention to your diet, before you pay attention to exercise, your job is breathing. I want you to build those things on after, but we got to go by ABC. ABC, airway, breathing, circulation. We learn that in basic life support. Diet and exercise are after. And this is how you know how important breathing is. It's the only thing, if you stop doing for 2 minutes, that it would make you die. There's nothing else on this planet that will make you die if you stop doing it for 2 minutes. So just realize you're responsible for making sure 10 breaths go into you a minute, and they should all start with a sniff, and you can fail. And you can be bad at it. If you did this 1% of the day, I'd be so happy. It's not money. There's no pharmaceuticals involved, but you can't skip this step, because if you skip this step, drugs aren't going to work, surgeries aren't going to work. Nothing. Well, maybe we'll get some temporary reprieve here, but if you want to live in age with health, you have to understanding that breath is your job, and nobody else can do it but you.
Yeah, and it's critical. I mean, we're talking about the same thing, but I want to turn this a little bit towards thyroid physiology, because a lot of the people that are listening have thyroid related issues. And so if you don't breathe well, especially if you don't nasal breathe, you have a reduced production of something called nitric oxide, which has an huge impact on vasodilation. Vagus nerve. So the vagus nerve is what we're talking about, and that runs through your carotids. I mean, if you go through the mechanics of this, and those run right past that thyroid gland. Okay, your thyroid is getting vagal stimulation. You must provide vagal stimulation to your thyroid, because that's almost how your thyroid, it's not like you're regulating your thyroid. Your thyroid's the regulator, right? I mean, your thyroid's the regulator of your body, in a sense. You know more about the thyroid than I do, but I assume it needs blood flow to function properly. Absolutely.
Yeah. So that's what you're providing when you breathe correctly. You're providing blood flow to this organ that can do its job for you if you just give it blood. And so that's why proper posture with your neck. And so your tongue should be on the top of your mouth when you breathe. And when you sniff, you can almost feel your thyroid getting the oxygen that it needs so that it doesn't dysregulate. So it knows how to manage your stress and your body symptoms. It can't do its job without you breathing.
Yeah. And along with that, if we are not breathing appropriately, getting appropriate oxygen into the system, you can't oxygenate the tissues, right? And there's a layer to this. When we breathe a lot chest-wise, we're breathing out a lot of carbon dioxide. And if we off-gassing too much carbon dioxide, we lose something called the Bohr effect, where red blood cells give up oxygen and pick up carbon dioxide. The only reason you're getting oxygen to those tissues is because the red blood cells actually giving up the oxygen. Some people are super excited because their oxygen saturation is 99%. Is that good? I don't know. Maybe
So
the oxygen has to
interesting.
be
Yeah.
lower, right? Because
So interesting. Yeah.
if you do, and if your cells get less oxygen, that activates the cell danger response. And then what happens? There's a natural down regulation of T4 to T3 conversion. Why? Because the mitochondria need lots of oxygen to function. If there's less oxygen, your cells are going to be like, "Ooh, we don't have oxygen to run this mitochondria full tilt. Let's reduce the T4 to T3 conversion." That slows down the metabolism and results in a more homeostatic regulation. So if you want to have better thyroid hormone conversion, you don't actually necessarily need to be adding stuff to the system. One of those foundational things is you must breathe better. And one of those times that you must really breathe better, we're oftentimes aware, maybe a lot of times not aware of how we breathe during the day, but more importantly, how we breathe at night when we're sleeping and we're not paying attention. Oftentimes, especially when people have low-grade inflammatory mechanisms going on, their nighttime breathing is awful. And so their brain's not getting appropriate oxygen.
So let's talk about night. Let's talk about nighttime. Let's talk about OSA a little bit. Let's talk about that stuff. People always ask me, because I basically teach all of my patients how to breathe. That's what I do before. And I demand they learn it before I operate on them, because I learned a long time ago that if I do not teach my patients how to breathe, they're going to recur their prolapse. It's going to drop right down again. People are they're pushing their bowels out. They don't know how to breathe them out. So, and so that breathing mechanism is so important so that you don't fail my surgery, that I'm making sure you understand it before you get on my table. So we're talking about the same types of things here. But I lost my train of thought. I wanted to say something important and I'm bothered now. Well, anyway, what were you saying?
We were talking about, you said, let's talk about nighttime breathing.
Oh, nighttime breathing. Okay. So people say to me, well, what do I do at night, doc? I got all these, I don't have so many problems during the day. How come I have OSA at night? Or how come I'm having all these problems at night? And I say, look, your body is asleep at night. You do not have breath control at night, but your body learns from you. At night, your body is going to take over the processes for you. But if you have not trained it during the day to do its job properly, it is not going to know what to do when you're away. It's just like you run a business, you want to take a vacation, you better train your workers to take over when you're gone. And if you are mouth breathing all day long, do not expect not to mouth breathe at night. Start training your body during the day. It is really hard to learn to nose breathe. Most of us are keeping our mouths open, or we're nose breathing with our chest, which is just as bad. Just as bad. If you think you're keeping your nose open and your nose is getting the inhale, but your chest is inflating, you're still not activating your nervous system properly. You have to let your belly out. You have to let your belly out.
So there's some technique. I mean, there's lots of techniques, and there's cultures that have been doing breath work for, I don't know, a couple thousand years as their primary mode of health, right? But there's Buteyko breath work. You've got Wim Hof out there, but they're not necessarily new techniques. Some of these things have just been modified, and somebody's put their name on them. But have you found through your work that some of these very old practices are still appropriate, or have you learned that there's new techniques or new processes to kind of retrain breathing that work a lot better to support the overall physiology, including the pelvic floor?
Yes. You want to hear my best one? I'm going to give you my best tip. You ready? Okay. So your back is straight, Eric?
Yeah.
Okay. And you're slightly leaned forward at your hip, right? Lean forward posture, 4 degrees lean forward, but your back is still straight. Yep. Let your belly out. Just let your belly out. No sucking in. Okay. Yep. Put your finger under your nose like a mustache. Close your mouth and just smell your finger. Yes. And don't clamp. See on the other side. Feel the breath go through you. That's how you breathe. That's how you pee. That's how you poop. That's how you breathe. Feel your whole body fill with air to the bottom. And it starts with a sniff. That's how you breathe. It's the only breath there is. Now you need to learn to take that without your finger under your nose. But I have all my patients on the toilet like that, or I have them using a nasal inhaler. If you use your smell pathways, It's like taking a deep inhale, like it was something you love. That's a breath. It's the breath you're supposed to take all day long. It's the only breath that actually regulates your nervous system, but it requires some mindfulness to take it. But I don't know breath techniques. I don't know yoga. I'm not a Pilates instructor. I'm not an exercise physiologist. I'm a urologist. I studied neurophysiology. That's how we got here. Doctors they study neurology, but we don't get all the training that everybody else gets that way. Okay. I'm just telling you, I understand the physiology of this. It starts with a snip. That's what opens your sphincter muscle. That's how you pee. And that's how you breathe.
Perfect. So since you already started on the topic, in traditional medicine, this is probably in my world, in the functional and integrative side, I think we've realized there's something else that needs to be done here. And maybe traditional medicine is on that line too now. But what is the traditional thought process around pelvic floor dysfunction? Is it realized as a real issue and a real problem? And what's the standard of care?
So pelvic floor dysfunction is not as realized it to be as widely prevalent as it is. Okay. We only consider someone to have pelvic floor dysfunction when they're symptomatic, right? So we see people when they're in their worst states, when they're peeing all over the place, when their bladders are hanging out of them, and we call that pelvic floor dysfunction. But I got to tell you, most of us think that it's because the pelvic floor is too weak and it needs to be strengthened. Okay. So we send you to somebody to strengthen your pelvic floor, and they tell you to do these Kegels exercises. That's the current standard of care. And if they fail, we'll do surgery. That's how my field treats the pelvic floor dysfunction. It's not correct. We need to understand that Kegels are not what we need to be doing. That's like going to a dentist and with TMJ and him telling you to clench your jaw tighter so your teeth fall out of your mouth, and then you'll fix your teeth clenching problems. You don't have teeth anymore. I mean, that's basically what they're saying. We need to understand that Kegels are enhancing childhood voiding dysfunction. That's not what we should be doing. We need to understand we have a second mouth on the other side that opens with airflow. And that's what we should be teaching people. But that's what gets rid of pelvic floor dysfunction. But we are absolutely telling women to do the opposite of what they should be doing. And that's why I'm angry. That's why I'm mad.
So is that, we make a lot of decisions based on bad research, bad studies, right? Cholesterol is bad for you. Don't eat fats because cholesterol is going to kill you. And, 25 years later, we realized a lot of that stuff wasn't necessarily true. Is that same thing here? We learned, muscle it's either weak and we need to strengthen it, or it's too tight. And we don't realize it's a combination of factors. Yeah.
We have too basic an understanding. It does not understand the complexities of what's going on down there. So what we have is a world of physicians who have a very too basic, a too overly simplified understanding of the pelvic floor. And it's really putting them in the wrong direction of how they're counseling their patients or the results they're getting. We just need to understand this pelvic floor is a mouth that opens and closes. It opens with air. We don't need to be squeezing it tighter. We need to be learning to release it. And I have to tell you, most of the doctors, they have pelvic floor dysfunction too. So they don't understand this either. You have to fix it in yourself before you can help somebody else. So we're all in a blind state trying to help each other. And it's normal because none of us have been toilet trained. So how should we possibly expect to know this stuff?
Yeah. And to be fair, we often teach things in a very reductionist views because it makes it easier to learn, right? X goes to Y, goes to Z, done.
Yeah.
Versus X is controlled by 16 different things, which then controls Y, which is potentially controls Y, but Y is also controlled by 16 things, which also affects X, right? And so, but we can't, it's too hard to learn in that model. And we do this.
It doesn't mean it's not what we have to learn. You see, just because the body's a little bit more complicated than maybe we can understand, it doesn't mean it's not our job to understand it. And by the way, I don't think it's that complicated. I think we just need to sort of break through some of these old, we have a lot of bad models, and we just need to knock them down. And the problem is that when you have models that have been around for so long, we have so much evidence based on them, and most of that evidence is terrible, by the way. There's no evidence that Kegels exercises help anybody. Of course they help. You're suppressing your urge, but at some point, things are going to get bad for you. Usually in menopause, if you continue to Kegel, you're going to watch what happens: urinary tract infections, all this stuff. You're putting your system out of balance. So, but we can't go back and change those studies because everybody already said they work.
Right.
And what are you going to do about that? We're in a pickle. It's like, how is it going to build it all again based on a new foundation? I don't know, but we have to. We must, or we're not going to get people better.
Yeah. And I think that's key. I mean, I think that's what I try to do. I think it sounds like what you're trying to do is change how we think about things. And there is a complexity. I agree. The human physiology is so complex. We don't know it all. But the idea that you're just a urologist or a urogynecologist, and you don't need to know about the nervous system, and you don't know how, I don't need to know anything about gut function or gut physiology, because all I deal with is the urinary tract. All of these systems are interrelated. Like,
yes.
And when we think about, oh, that's a blood sugar issue, that's not related to what I'm doing. Sure it is. If you've got stress that's causing you problems with your pelvic floor, that same stress is causing you to be glucose resistant. And if you've got that going on, then you've got low grade inflammation, and you've got downregulation. We're
siloed in medicine. So we don't know what's going on the other side of the curtain. We don't understand that our colorectal partners are dealing with the same stuff we are, but just in a slightly different part of the body, or that our endocrinologists are dealing with the same thing, but in a different way. We're not talking to each other because if we did talk to each other, if we weren't siloed, we would understand this stuff a little bit more. But urologists are different. See, we are, because we understand the nervous system. We learn the nervous system in our training. That's why we're very specialized, okay? So if anybody can understand this stuff, it's us. It's really, I feel like this falls on the urologist, because we're looking down, we're at the pelvic floor, but we're also understanding how nervous system control the bladder. Mm-hmm. So and we're surgeons, so we're in there looking at the muscles, we're operating on them, we can feel them. I am in the perfect place. I have the perfect perspective to understand this stuff, which is why I'm angry with the people who haven't, okay, in my field. Because I'm like, why are you not getting this? You are watching these women clench. You are watching as you're examining her, she's squeezing her pelvic floor. And you're like, do you know you're doing that? And she's like, no. It's unconscious stuff. You got to wake people up and say, stop clamping. You don't know you're doing it. Learn to breathe.
Yeah.
Okay. And it's our job.
So I guess the next question, because we're going to get into maybe some strategies here. Somebody might say, you can't reestablish pelvic control. Can somebody? Because I've talked to a lot of clients who said, and I think we're going to explain to them why, but they've said, hey, I've done pelvic floor stuff and it hasn't really worked. And I'll usually...
It's because they're Kegeling. It's because they're Kegeling. It doesn't work because they're not under. And I got to tell you, there's a lot of pelvic floor therapists who do understand this stuff, and I have, listen, I'm out there on social media. I have a nice following of pelvic floor therapists, but there's a lot that do not. Okay, I'm going to give them about 50-50. Some of them are terrible. And I'm not going to name names, but a lot of them are TikTok. And they are telling women to squeeze pelvic floor. This is causing terrible harm to people, and they don't understand it. They just do not understand it. They don't understand the neurophysiology of this. It makes me so mad. It really does. I don't even know what to say.
So I would say, usually when I'm talking to those clients, one of the primary things I'm talking to them about, is we got to reduce the overall real or perceived stress load. So if you do the exercise, but you're still arguing with your spouse every day, and you're still eating a bunch of crappy food, and you're sitting all day, and you're not focused on your posture, your breath work, and all those things, it's just a Band-Aid. It's just like, right? Like, I'm working it, but am I working it right? Like, you can lift weights and do it wrong and create, I injured my shoulder. Why did I do that? Because you had terrible technique. You had terrible.
Exactly. Right. Exactly. So here's the thing. If you understand that your sniff hits your bottom, you're going to know how to be in proper posture, because your sniff only hits your bottom when you're in the correct posture. Okay. So that is how it's an internal biofeedback system that you have that basically tells you how to hold your back, how to hold your belly, because if you sniff enhance your respiration, you will always have to be in the correct posture. You have this internal biofeedback system so that whatever's going on around you, whether your spouse is yelling at you, whether you're in a bad place in the operating room and the case is getting hard, if you are doing sniff enhanced respiration, The entire time, your judgment's going to be fine. Your whatever those crazy ruminating thoughts, the negative thoughts, they're going to go away because you're regulating your nervous system and you can do what you need to do. And you can treat people nicely too, because you're not taking it out on them. And this is what we're talking about here. That's why breath and posture are the seat of it all. The diet, the exercise, that's just part of it too. I'm not saying leave those things out, but you have to learn to regulate your nervous system so all this other stuff doesn't, so you can eat a little bit of junk, okay? You can eat a little bit of junk. Go take an ice cream cone, okay? Just regulate your nervous system while you do it. This is all I'm saying. I don't want people to be in a state where I have to eat right, I have to exercise 50 miles a day. This is not what we're talking about. Get the breath right. Your body will tell you what it needs, okay?
So is the key to the nasal breathing the sniff? Like if somebody says, well, how do I know if I'm doing it right? Because they can do a nasal breath. They should be able to
sniff.
feel.
You have to sniff. The sniff is the sensory motor awareness of the others. Your sniff is a sensory organ, okay? It is for all the animals too. We're animals, okay? Our sniff is how we discover our insides. You have to sniff internally and you have to let your belly out when you do it. And you suddenly get a picture of how the internal structures of your body look. You can see your pelvic floor, you can see your lower back, you can see your belly go out. Your brain is getting an image of what is going on. If you do not have that internal biofeedback system, you really can't control your body and your primitive reflexes. The sniff is the key to that. So you're learning to sniff without guarding. Sniff without guarding. Sniff and allow. That's what you're doing. And that's how you breathe.
And so as they do the sniff, not necessarily doing a deep nasal breath, but doing just regular sniff, then they'll start to get a greater perception.
They're building the mind. This is the mind-body connection. The sniff to the pelvic floor. So we call it pelvic floor awareness. That's in urology, or pelvic floor physiology, we call it pelvic floor awareness. You can substitute that for the mind-body connection. The way you know where your pelvic floor is you sniff. It's a quick sniff and you feel your bottom open. Then you've graduated the last stage of child development when you realize that full through pathway, when you sniff at your bottom, and everything is based on that. You cannot, that's your central core. You cannot leave it. It's your lifeline. And I teach this to all that's your lifeline. You were born with it. You just didn't know it was there because you needed to go through the developmental stages to get to it. But let me tell you something, if nobody tells you it's there, you will never know.
So 10 sniffs in a minute or 10 sniffs an hour.
They're not sniffs. They're not sniffs. They're sniff inhalations. Okay. I don't want to, because some people come into me, and by the way, this takes a while. This is a long process. It takes months and it gets better each time. But the quick sniff is how you feel it below. But what you're trying to do is not clamp against your sniff and make it into a breath. So I tell people, put your finger under your nose and just smell your finger. It is going to be the best way for you to understand what I'm talking about. This is an embodied awareness you're trying to feel. Okay.
So people are listening to this and they're like, all right, well, maybe I need to go get some help with this process, right? How does somebody know, or what should somebody look for when they're looking for somebody to help them with their pelvic floor dysfunction? Because there's signs everywhere. I'm going to drive to the mountains this afternoon and I know I'm going to see at least 6 therapy places with signs up of pelvic floor advertising. So
it's great. I love that. I love that there's so much awareness to pelvic floor function in general, whether or not we're doing it right. I'm just glad that we're even talking about this stuff. You understand the reason we've gotten this far is we're not talking about this stuff. People are very embarrassed to talk about things like bladder leakage and stool leakage. It's really gone under the radar, mostly because we just don't want to deal with it. We bury it. So the fact that people are advertising pelvic floor, I love that. Now, how do you find a good pelvic floor therapist or a good doctor? Anyone who doesn't tell you to Kegel is good in my book. Okay. You have to find someone who is not asking you to do squeezing stuff, because that is not what you're supposed to be learning. You're supposed to be learning release. So honestly, there are a lot of pelvic floor therapists that just teach breathing. Just find one of those. They're on the right track. Okay. If they're not talking about breath or how it coordinates with your pelvic floor, they're really missing something. Okay.
All right. So there's a couple things that I've seen out there. One of those is there's something called the cooch ball. Have you seen this?
God, that sounds interesting.
So
I've seen a lot. I haven't seen that one, but I've seen a lot of Kegel trainers, if that's what you're talking about. Is it another Kegel trainer, something you wear inside your vagina and you kind of become aware of it?
This is a round ball that essentially helps kind of break down the tension. You actually sit on the ball,
Mhm.
and I'm not sure if it, I think it,
Yeah,
not sure
but
if it
I know
vibrates
those
or not, but
things.
it just kind of good or bad.
So so I'm going to tell you I'm not sure about those things. Okay? I see a lot of stuff. And by the way, I don't ever recommend these things to my patients. I do sometimes send people to pelvic floor therapists who recommend these types of things. But there are things like the Emsella chair, these chairs that you sit on that deliver like a vibration to your pelvic floor. And I think the concept of sitting on the ball is just fine. Anything that's making you aware of the muscles that you're
Mhm.
sitting on, to not clamp on them and to spread them out and to stretch them, those are all good things. I like the stuff that vibrates too, because it's sort of making you aware of that part of your body. I don't think it's harmful at all. Um, it is not the same as someone telling you to go in and put this thing inside of your body and squeeze around it 10 times. That's what I object to. I don't like Kegel trainers.
Yeah. So something that gives you, wakes up that neural connection, vibration,
Yes,
any
I
type
have
of
no problem with
stimulation in
that.
that area is going to be
I do
what.
a lot of sacral nerve modulation too. So
Mhm.
I'm someone who implants sacral nerve stimulators, which basically is an implant that you could get that almost wakes up these processes. So we have a couple of companies that make these devices, and we're basically putting an electrode near their tailbone into their S3 foramen, and we're stimulating their pelvic floor because the pudendal nerve is right there. We're not
Mhm.
You can stimulate the pudendal, so that's an off-label thing. We're mostly stimulating right at the sacral foramen, and we're sending a nerve impulse right to that area. And what is it doing? It's building that mind body connection for patients, especially the ones that will never breathe. I saw a woman yesterday. I'm just thinking about this woman. She was older, and she was sitting like this, like way back, right? Like this. She's like this in her chair. This is a lot of older people are in this posture, and
Mhm.
her head was like this at a 90-degree angle. So if I got her to sit up, she was looking in her lap.
Yeah.
There was no other way to move her. Um, Look, I'm never going to get this woman to breathe. It's not possible. The osteoarthritis in the back of her neck is so strong, she could never pick her neck up to sniff.
Yeah.
So, yeah, I love bladder stimulators for those people because it's a way to build that connection without them doing all the work. But I think most people can do the work. They should do the work.
Yeah. Um, Squatty potty, yay or nay?
Okay, I get so many questions about the squatty potty, and I want to tell you my opinion about it goes back and forth and back and forth. Okay, I'm going to tell you what I like about the squatty potty. What I like about it is that I want your feet grounded.
Mhm.
Okay, I want your feet on a structure, flat, preferably flat. So that means if you're on your toilet, I want your feet flat on the ground. It's very important for your body. See, when you're in toilet posture, your body needs to be grounded. It needs to feel grounded. Your body needs to feel safe. Your body will not release properly if it's not in safe posture. So feet on the floor fully is important. And if you have short legs and you have a high toilet, short legs, if your feet are not reaching the floor, I want you to have a stool under your feet. Now, that's what I like about the squatty potty. Nothing else. Okay. What I don't like about the squatty potty is how it sits you back onto your tailbone and it puts your thighs above your hips. I want your legs parallel to the floor, parallel. So some people, their legs are too high up. And the reason I want that is I want you to be able to lean forward and feel the tailbone move backwards when you breathe. Okay, when you're planted on your tailbone, you cannot feel the motion the same. So I kind of don't like this position where you're upright with your legs up on the squatty potty. I'd rather you lean forward. So that's my spiel on the squatty potty. It works for people, but it's really just allowing you to push harder and get the stool out. So I'd rather you, because you're in the right posture, I'd rather you learn to do it with your breath.
From a physical standpoint, one of the big challenges I think for a lot of people is they've lost the ability to do a basic, what we call grok squat, like to be able to get down into a squatted position, which is more common they call it in the United States, we call it the American squat, where you're up on your tippy
Yeah.
toes and go down in other places of the world, they
I'm one of those
flat.
people. I can't do it either. I'm terrible. You don't have to be able to do that to be able to toilet properly. You need to have a sacroiliac angle. That's all you need to do. You have to lean forward from your hip. And these are very subtle postural maneuvers where you have a straight back and the hip flexion is one thing that we really lose, and we lose it with age. So I tell everybody, if you want to preserve one thing, preserve that angle. It doesn't have to be as deep as the angle that you're talking about. That's great if you can get into it. But on the toilet, you just have to have a 45-degree angle. That's all you need.
All right. And so we're going to start working on wrapping this process up. So we'll start with, if somebody they have a pelvic floor issue, I'm guessing you're going to say the place to start is with the sniffs, the finger sniffing. But are there other like 2 or 3 primary recommendations that you would give to somebody like, okay, I've got an issue. Where do I start?
So I always think you should see somebody. Okay. If you have an issue, you should see somebody. I'm talking to the people who don't really have issues, which is so hard because who's going to listen? Who does? It's like talking to children and telling them to go, put a coat on when you go outside. They don't listen. They're fine. If you really have a problem, you should see a physician. Okay. Or a provider. It doesn't have to be a physician. It could be a nurse practitioner. Do I like you going right to the pelvic floor therapist? I probably want you to see a clinician first. Okay. But I want you to understand that pelvic floor therapy might be something you need to do as well. I think everybody needs it. Unfortunately, there's not enough pelvic floor therapists and good ones to treat the entire population of people who have pelvic floor dysfunction. There's just not enough of us. So it's good for you to understand some of these techniques on your own. But if you go to a pelvic floor therapist, they're going to teach you all these other exercises. I think yoga is great. I think, a lot of those sort of, Pilates is okay as long as you're not doing a lot of stomach sucking. I want you to stop stomach. I want you to pay attention to your body. I want you to realize you're not supposed to stomach suck. We're the only animal on the planet that does it. And you just got to realize that if you're sucking your stomach in, you're going to create a dysfunction in your pelvic floor, and it's going to affect your entire body. That's a great place to start. Pay attention. Just look at do a body check. Am I stucking my stomach in? If you are, let it out and breathe. It's a simple thing that you can do even before you go to the doctor. I want to tell you something. If you did that, 90% of my pelvic pain patients would never come to me. This is what they do. They have pelvic pain. I got a cramp. I got a pain. I got a this. I say, sniff. Is it gone? Yes, it's gone. It's that simple. But we have this powerful system in our body that we are not using, and we're running to the doctor to get them to teach us to sniff our bottoms out. I mean, this is ridiculous. Can't we be a little bit more, deliberate in what we tell people?
Well, sometimes, we don't want to give everybody the secret. In my world,
Why?
I think we should tell everybody, like, do the foundational things first. Like, do all of the foundational things and work on building those things up. And then if you still have an issue, then you probably need me to dig into the deeper chemistry. But you don't need me to tell you to eat a healthy Mediterranean style diet. You don't need me to tell you need to do some physical activity and training every day. You don't need me to tell you need to get 7 to 8 hours of quality sleep per night. You don't need me to tell you need to learn how to breathe and do it regularly. I mean, people fight me on the.
But we do. Part. We need you because you're the only one saying it. See, you don't understand. No one else is saying it. They're not hearing it from anybody else. They're hearing it, but they're not hearing it in a way that, so they can hear it. They can say, okay, I know I'm supposed to eat right. I know I'm supposed to sleep, but they're not hearing if you don't. Just these clear messages. If you mouth breathe, you're going to take a minute off your life every time you mouth breathe. They need to hear it like that, because if they don't, they will not take it seriously. Well, they will still look to medicines to fix them. But you need to just hear it I'm very almost hyperbolic with my patients. I'm like, I know I sound extreme, but I want you to hear it like this because you haven't been hearing it anywhere else. So I want you to just hear this very strong message.
Yeah, I think that's good. I mean, I continue to spread that message for the very reason, because these are things that everybody can do if they just put some effort into doing it. So you have a book out. So let's talk about the book, The Second Mouth. Does it get into some of these techniques that they might be able to do?
It's a story. The Second Mouth is a story. It's a story about how I learned all this stuff, because I want you to know I didn't learn it in school. I learned it from my patients. I learned it from taking care of people and seeing these patterns in everybody and just not being able to ignore them anymore. And the book was about that discovery. which was different than everything that I had learned because I learned to tell people to Kegel too, right? That's what I learned. So it's a book about that. It's about discovering something that's new and different that maybe you hadn't heard before, but that you know is right. And it also takes you through patient visits. So you can find a patient in there that's just like you. They're all fictionalized characters, but I really hit the gamut of pelvic floor diseases, whether it's overactive bladder or recurrent urinary tract infections or blood in the urine. There's a patient with what you have, and I'm telling you why she has it. And you're going to see yourself in her. And it's going to make you understand these processes a little bit more. And then I do have at the end of the book some of these techniques about how to learn to breathe, how to learn to toilet, and the things that you're supposed to be doing. And that you're not supposed to be holding your pee either. See, this is the other thing. We all walk around butt clenching all day long, holding in, and it is not our job to do that. We need to let our organs do it for us because they do a great job at holding for us, but they do need some air to do that. They need some breath to hold. So if you're just clenching instead of giving them air, you're going to start to become incontinent. And this is what I teach. It's the opposite of what you think. It's about a little bit more awareness. That's all.
Perfect. So if somebody wants to hear more about what you say and what you're trying to promote, where do they go?
So keep an eye out for me because I'm being very loud. I'm trying to go. I don't want to. I'm so busy right now. I mean, I'm operating. I'm seeing 100 patients a week. I'm not looking for more patients. But if you do want to find me, you can. But this is not the point of this. Okay, I don't need more patients. We're overwhelmed with patients. What I'm trying to do is get a message out so you don't need me. I'm trying to get you to not need me. So I'm going to be on any podcast that will listen to me. I'm on social media. I'm on TikTok. I'm on Instagram. I'm on LinkedIn. I'm at Dr. Nicole Fleischmann. And I'm just putting out these kinds of messages because I know that I am correct in this thinking. And I don't think you're going to hear it very often from other people until you do. In 100 years from now, everybody's going to know this stuff. I'm just a little ahead of my time.
Awesome. Well, I appreciate you coming on the Thyroid Answers podcast. I think we got the message across. And
thank you so much for listening to me.
Maybe sometime in the future, we'll have you back on and see where your research has you at that point and your what new techniques that you've learned to help somebody with these conditions.
I love it. Thank you so much for having me, Eric. This is really fun.